want my colleagues, Mr. Speaker, to listen to what happens when you have socialized medicine. This is a Canadian story I'm going to tell you about. In fact, there's more than one. This is from Shona Holmes. She's a Canadian. She says, after suffering from crushing headaches and vision problems, I was diagnosed with a brain tumor 4 years ago. She was told if it wasn't removed, she'd go blind or even die. American doctors at the Mayo Clinic said to me that you had a brain tumor and it was pressing on your optic chiasm and it needed to come out immediately. Holmes was told by her doctor in Canada that she had to wait 4 months before she could see an endocrinologist and 6 months for a neurologist. She's a Canadian, and she says that the doctors at the Mayo Clinic, where she turned to, got to her right away because they couldn't get to her fast enough in Canada. She ended up having to pay about $100,000 because they couldn't take care of the problem in Canada as that healthcare system was supposed to do. She and her husband were forced to put a second mortgage on their home and borrow money from family and friends. There's another story. A prime example is the Kingston General Hospital in Ontario, where they have staggering delays. Senator McConnell and the other body claims that on average there's a 340-day wait for knee replacements and a 196-day wait for hip replacements. The chief of staff at that hospital says, quote, in our Canada healthcare system, we're looking at what we have to do to prioritize patients. They're on somebody's waiting list if they have a problem. They have to wait. Another Canadian, Rick Hession, has a heart condition that could cause a stroke, but he has a 3 month or more wait for an operation to correct it. Socialized medicine, government-controlled health care does not work. It costs a lot of money, and you have to wait, and they ration care. This is the program that the Democrats are promising. And all of these white areas are new agencies of government that you're going to have to go through to get your health care. And it's going to cost between $1 and $3 trillion over the next decade. And that's money we don't have, money we're going to have to print or borrow. And it's going to cause inflation. So we not only have a health care problem we're going to create, much worse than anything we face today, something that's going to be equivalent to what they're doing in Canada and England, which does not provide care for those people, and rations care, and it costs through the nose. The American people need to know these facts, and my colleagues on the Democrat side are trying to rush this through before the August recess so the American people won't know what all this means. And I think it's a tragedy. We need more time so the American people can realize what they're going to have to experience if we get a socialized Canadian-style health care program. I yield back the balance of my time.
The gentleman yields back. Ms. Woolsey, California. For what purpose?